Okay, let's dive in. Bringing a new life into the world. I mean, it's just one of those huge life-changing experiences, isn't it?
Absolutely monumental.
Yeah, filled with so much wonder and anticipation, but also, let's be real, loads of questions. Questions about what on earth is going on inside your body, what's coming next.
Exactly. It's a time of massive physical change, emotional change too, and just navigating all that, feeling like you have some idea what's happening, that could really help ease the anxiety.
For sure. And that's pretty much the journey we're exploring today. We've taken a really close look at a guide. Lots of people rely on the fourth edition of What to Expect When You're Expecting. And the feedback you shared about this source, it's actually pretty amazing.
It really is. I mean, we're seeing comments from doctors calling it a lifesaver, even a Bible for new moms.
Wow. Bible, huh?
Yeah. And mothers themselves calling it their essential survival guide, a roadmap, just full of useful information. When you get that kind of praise from both the medical side and the people actually living it, it says a lot about the trust it's built up.
Yeah, definitely. And it's clear, looking at the acknowledgments and stuff, that a huge amount of effort and expertise went into it. Lots of fact-checking, different specialists involved.
Precisely. It's designed to be really comprehensive, covering things from all sorts of angles, giving guidance based on, well, established medical knowledge.
So our mission today, then, is to take your source material, these key parts from this really detailed guide, and kind of pull out the most important bits of knowledge, the key insights.
Right. Think of this deep dive as maybe a shortcut, a way for you to feel more informed, more prepared, without having to read every single word yourself.
Exactly. We're here to walk you through the material you gave us, help you figure out what really stands out as important, maybe even surprising, as you're thinking about or starting this whole journey.
And we'll follow the structure the source uses, mostly chronological.
Mm.
So starting even before conception, then moving through the pregnancy itself, the physical stuff, the emotional stuff, health things, potential complications,
How's that?
then labor and delivery, and finally that whole postpartum period adjusting to life with a baby for, well, for everyone involved.
Sounds like a solid plan for our deep dive. So according to this guide, where does the journey really kick off? It actually starts before you even have a positive pregnancy test.
Right, that's exactly right.
Hmm.
The source puts a lot of weight on what it calls the preconception period, and it makes a really key point straight away. Getting ready for pregnancy isn't just for the person who's going to carry the baby.
Ah,
It's framed very much as a joint effort, a team thing involving both partners right from the get-go.
I like that. A team effort. So what kinds of steps does it recommend for this prep phase?
Well, a big one is for both partners to get a checkup with their doctor. For the woman, it's about checking for any existing health conditions, looking at medications, lifestyle things that might affect getting pregnant or the pregnancy itself.
Right. And for the guy, how does the source talk about his health here?
It says his checkup is important too. It could uncover things affecting conception, like maybe chronic conditions impacting fertility or even side effects from medications he might be taking.
Oh, interesting. Like what?
Well, the source specifically mentions some meds that could cause issues like erectile dysfunction or lower sperm counts. So it really underlines the idea that both partners being in the best possible health is beneficial.
That makes total sense. Joint creation, joint preparation, right?
Exactly.
The source also gets into genetic screening. That can sound a bit intense, but it explains who might want to consider it.
Yes, it highlights genetic screening based on your ethnic background or family history. And it gets quite specific, giving examples like screening for cystic fibrosis if you're Caucasian, Pay-Sacs for people with Ashkenazi Jewish, French Canadian, or Louisiana Cajun roots,
Okay.
sickle cell trait for those of African descent, and thalassemias for people with Greek, Italian, Southeast Asian, or Filipino heritage.
Wow, that's really detailed. Helpful for knowing if it applies to you.
Mm-hmm. And it also suggests genetic counseling if you've had certain issues before, like maybe 2 or more miscarriages, or if you already have a child with a birth defect. And interestingly, also, if the partners are blood relatives, like cousins.
Right, because that increases the risk for some genetic conditions.
Precisely.
So understanding potential risks based on your background. Okay, beyond the checkups and screening, what about nutrition? Prenatal vitamins are always mentioned, but the source really pushes starting them early, doesn't it?
Absolutely. Starting a prenatal vitamin is a top recommendation, specifically one with at least 400 micrograms of folic acid. And here's the key part. The source says start it ideally 2 months before you even begin trying to conceive.
2 months before. Wow.
Yeah, that early start is just crucial because it helps prevent certain birth defects, like neural tube defects, which can happen super early in pregnancy, sometimes before you even know you're pregnant.
Gotcha. That early folic acid is such key advice. Does it mention any other specific vitamins for this stage?
It does mention that some research suggests getting enough vitamin B6, at least 10 milligrams before pregnancy, or right at the start, might help reduce nausea and vomiting later on.
Oh, that's a good tip.
And zinc, about 15 milligrams, is mentioned for maybe helping fertility. But, and this is important, the source really cautions against just taking a bunch of other supplements without checking with your doctor. Too much of certain things can actually be harmful. So it's not about just grabbing everything off the shelf.
Good reminder. More isn't always better there. Okay, the source also talks about tracking ovulation with basal body temperature, BBT. How does that work, according to the guide?
Right, so BBT charting. The source explains you take your temperature first thing in the morning, like immediately when you wake up. Ideally after 3 to 5 hours of solid sleep.
Okay.
And crucially, before you move, talk, sit up, anything. Just get that baseline temperature.
And what does that baseline tell you?
According to the source, your BBT is usually lowest right around ovulation. Then it typically jumps up about half a degree Fahrenheit after ovulation has already happened.
Ah, okay, so that's the catch, isn't it? It tells you ovulation did happen, but not when it's about to happen.
Exactly. The source is very clear about this limitation. Charting BBT confirms ovulation occurred maybe 2 or 3 days ago. It doesn't predict it in advance, which is what you'd need for timing intercourse perfectly in that cycle.
Right, so it's more about seeing a pattern over time.
Pretty much.
Yeah.
Useful for understanding your cycle, but maybe not the best tool for pinpointing the fertile window this month.
That's a really important distinction. I like that the source also busts some common myths, like the old advice about how often to have sex when you're trying.
Yes. It directly tackles that myth that having sex every single day around ovulation lowers sperm count. The source actually points to recent research suggesting the opposite.
Oh, really?
Yeah, having sex every day during that fertile window might actually be slightly more likely to lead to pregnancy than doing it every other day. Their little summary is basically more is more.
Okay. Forget the every other day rule then.
Huh.
And what about the classic boxers versus briefs debate for male fertility?
This source kind of throws its hands up on that one. Says scientists haven't really definitively proven one is better than the other, so maybe just go with whatever's comfortable for now.
Fair enough. I also really appreciate that the source includes advice specifically for the dad-to-be during this trying to conceive phase. It highlights something easy to forget. Relaxation.
It does. Stress isn't just in your head, right? The source explains it can actually have physical effects on the father-to-be. It can mess with libido, performance, testosterone levels, even sperm production.
Wow.
So the advice is pretty simple, though maybe not always easy to follow. Just try to relax and enjoy the process. Less pressure might actually, help things along.
That feels like really important advice for both partners, reducing that stress. Okay, so all this prep happens, and then comes the big question. Is it actually happening? How does the source cover diagnosing pregnancy?
Well, it kind of nods to intuition first, saying some women just feel pregnant almost immediately. But then it quickly pivots to, reliable science for confirmation.
And the most common method it talks about is the home pregnancy test, the HPT.
Yeah, it describes them as easy, private, fast, and generally very accurate if you use them right and at the right time. It mentions some are sensitive enough to use even before you miss your period.
Right.
But accuracy definitely goes up the closer you are to your expected period date, or even after you've missed it.
So what if you get a negative test, but you still feel pregnant or have symptoms? Does the source offer advice there?
It does. If you're actively trying to conceive, get a negative test, but still have that gut feeling or maybe some early signs, the source recommends basically acting as if you are pregnant.
Okay, how so?
Meaning start or continue all those preconception steps we just talked about, especially taking that prenatal vitamin with folic acid. That way, you're creating the best possible environment just in case while you wait to test again or see your doctor.
That's really smart. Proactive, just in case. Okay, so confirmation happens, and then bam, the incredible transformative months of pregnancy really begin.
And the source is really clear from the start. These months are packed with changes, both physical and emotional. And a huge point it makes up front is that every single pregnancy is unique.
That's comforting, I think.
Totally. Symptoms can vary like crazy, the mix, when they show up, how intense they are, not just between different women, but even for the same woman from one pregnancy to the next.
Knowing that your experience doesn't have to match your friends or even your last pregnancy, that's helpful. The source then dives into specific physical stuff, often explaining the why behind it. Fatigue seems like a really big one.
Oh, huge. Fatigue, low energy, just feeling sleepy, super common, especially in the first trimester when your body is working overtime to get things going. And then again in the last trimester when things just get physically demanding.
And the constant peeing, I hear that's almost guaranteed.
Very common. The source links it to hormonal shifts and, yeah, the growing uterus putting pressure on your bladder. Simple mechanics, really.
Then there's the infamous nausea, morning sickness.
Yes. And the source is quick to point out the name is misleading. It can hit any time, day or night. Often worse when your stomach's empty.
Any tips from the source on managing it?
Yeah, practical stuff. Eat something small first thing, maybe even before getting out of bed. Keep some crackers or something plain by your bedside for middle of the night or early morning nibbling.
Good idea. It also lists things like excess saliva, constipation, heartburn, indigestion, gas, bloating. For constipation, it really breaks down why.
It does. Links it both to the uterus pressure again and also pregnancy hormones, especially progesterone. Progesterone relaxes smooth muscles everywhere, including your gut, so things just slow down.
And it offers ways to fight back, right, against the constipation.
Absolutely. The main advice is upping your fiber, aiming for 25 to 35 grams a day. From things like fruits, veggies, whole grains, beans, dried fruit. It even specifically calls out kiwi fruit as being pretty potent.
Kiwi, huh? Good to know.
But it also wisely suggests adding fiber gradually so you don't make the gas and bloating worse, which are already common thanks to that same progesterone and uterus pressure.
Huh. So the same hormone messing with digestion causes gas, too. Fun times.
It's all connected. Heartburn and indigestion are also linked to those relaxed muscles letting stomach acid creep back up, plus the uterus crowding things later on. The source mentions maybe needing to discuss GERD treatments with your doctor.
And then food aversions and cravings, the pregnancy cliches.
But totally real for so many people.
Yeah.
The source blames hormonal shifts, altering taste and smell. You know, the classic pickles and ice cream image exists for a reason, but it could be anything, really. And suddenly, hating foods you used to love is also common.
And typically, after the morning sickness fades, appetite picks up.
Usually, yeah. Once the nausea eases, your body's working hard and needs fuel. Though, as we'll get to, the whole eating for two idea needs some clarification.
Right. Before we hit nutrition fully, the source also details breast changes. This is often one of the very first signs people notice, isn't it?
Definitely. Sometimes within weeks, way before there's any bump, the source lists a whole range.
Yeah.
Feeling full, heavy, tender, maybe a tingling sensation. The areola is getting darker, those little bumps on them becoming more prominent. Those are Montgomery's glands. They help lubricate and seeing more blue veins under the skin.
And what's causing all that?
Mostly those surging pregnancy hormones, plus some extra fat buildup. It's all part of the body's amazing prep work for potentially feeding a baby. A very clear physical signal that big things are happening.
Moving beyond those really common signs, the source talks about other changes that might be less expected but still pretty frequent, like getting a stuffy nose or even nosebleeds.
Yeah, those get mentioned, along with feeling like your ears are stuffed up sometimes. Again, it often comes back to hormones causing capillaries to swell up all over, including in your nose and your eustachian tubes.
And sensitive gums, bleeding when you brush.
Also common. Hormones make your gums more prone to plaque and bacteria, raising the risk for gingivitis or decay. But the source reassures that getting dental work done, like cleanings or fillings, is generally safe and actually important during pregnancy.
Good to know. Mild breathlessness is also mentioned as normal, just maybe uncomfortable.
Correct. Hormones stimulate your breathing, capillaries swell, and later the uterus crowds your lungs. Not dangerous, just
Yeah.
uncomfortable.
Leg cramps can pop up too, sometimes even after sex, apparently.
Yes, the source notes that and suggests a gentle low back rub might help. Mild swelling in ankles and feet, maybe hands and face sometimes, that's common too, from all the extra fluid your body's holding on to.
And didn't the source have kind of counterintuitive advice for swelling?
It did. Paradoxically, it suggests drinking more water can help reduce swelling by helping your body flush out the excess fluids. Staying hydrated is key.
Okay, drink more water to reduce swelling. Got it. Varicose veins or hemorrhoids are also discussed.
Yeah, genetics plays a role, but also the increased blood volume, The uterus pressure and hormones relaxing vein walls all contribute. The source really emphasizes prevention strategies for managing these.
The source also covers changes to your skin. What kind of things?
All sorts. Irritated rashes from products you use to tolerate, fine suggesting switching things up. Pigmentation changes like that dark line down your belly, the linea nigra or melasma patches on your face. Stretch marks, of course,
Right. What's the take on stretch marks?
that they fade to silvery lines eventually. Postpartum options like laser or Retin-A exist, but need discussion with the dermatologist. In the meantime, the source kind of encourages you to wear them with pride. Also, dry skin, oily skin, spider veins, those are possibilities too.
And getting tattoos during pregnancy, what's the verdict there?
The advice is basically don't do it. Not because the ink itself harms the baby, it doesn't get into the bloodstream, but because any needle carries an infection risk, and you want to avoid any unnecessary infection risk during pregnancy.
Makes sense. Okay, and the cognitive stuff, what people call pregnancy brain.
The source definitely acknowledges this is a thing. Forgetfulness, trouble concentrating. It links it to a mix of factors. Hormones, definitely lack of sleep, just general energy drain, and also the sheer mental bandwidth being taken up by thinking about the baby and all the prep.
So it's not just you imagining it. Are there coping strategies?
Yeah, practical ones. Making lists, using phone reminders, calendar alerts, sticking notes everywhere, and maybe most importantly, trying to have a sense of humor about it and accepting it's just part of the deal for many people.
Just validating all these physical things is huge. Shifting gears a bit, what about the emotional side? Mood swings are practically synonymous with pregnancy in popular culture.
They are. And the source lists them as a common reality. Again, it points to that combo of fatigue and hormone fluctuations. And it really highlights the partner's role here, understanding it's physiological, not personal, and knowing how to offer support. Communication is key. The pregnant person letting their partner know what helps.
Stress also gets a mention, finding ways to cope.
Simple advice, but crucial. And fear of miscarriage is brought up as being very common and understandable, especially for first pregnancies or if you've had a loss before. The source offers reassurance that most pregnancies go smoothly, and common things like mild cramps or spotting are often nothing to worry about, but always report them to your doctor or midwife just in case.
Okay, so managing the normal, everyday changes is one thing. The source also goes into detail about staying healthy and handling specific concerns.
Yes, it provides a lot of guidance on diet and nutrition, kicking off with clarifying that whole eating for two idea.
Right, it doesn't mean literally eating double, does it?
Not at all. The source really emphasizes the baby's needs are pretty modest, calorie-wise. On average, only about 300 extra calories a day. And interestingly, it says 0 extra in the first trimester, unless you started out underweight.
Oh, wow, 0 extra.
Yeah, then maybe 300, 350 extra in the second trimester, and up to about 500 extra near the end. The real focus isn't quantity, it's quality, nutrient density.
That's where efficient eating comes in.
Exactly. Choosing foods packed with nutrients, lean proteins, low-fat dairy, grilled instead of fried. Trying to pick foods that tick multiple boxes in their pregnancy daily dozen. And for those struggling to gain weight, it suggests healthy, calorie-dense foods like avocado, nuts, dried fruit.
Tell me more about this daily dozen. What are some key parts?
Calcium's a big one. The goal is 4 servings daily, aiming for about 1,200 milligrams total. The source gives really concrete examples. A serving might be an ounce of cheese, a cup of milk or yogurt, canned salmon or sardines with the bones, sesame seeds, certain leafy greens, edamame, even molasses. And things like cottage cheese, tofu, dried figs offer bonus calcium.
That's helpful having specific examples. What about fluids?
Fluids are super important. At least 8-ounce glasses a day is the recommendation. The reasoning is simple. You're drinking for 2, the baby's body is mostly fluid, plus your own blood volume ramps up massively.
And the benefits of staying hydrated are pretty expensive.
Huge. Helps your skin, eases constipation, helps flush toxins, can reduce swelling, remember that paradox, and lowers the risk of UTIs and even preterm labor. You need even more if you're retaining fluid, exercising, or it's hot out. One practical tip. Try not to gulp down tons of water right before meals so you don't fill up too much to eat your actual food.
Good tip. What about specific dietary approaches like vegetarianism?
The source says vegetarian diets can be perfectly healthy during pregnancy, but it requires careful planning, especially for protein. Easier if you eat eggs and dairy, ovalacco, a bit more challenging for vegans who really need to focus on getting enough protein, B12, iron, and other key nutrients.
And sugar. How does it advise handling those sweet cravings?
Basically, swap refined sugar for natural sources like fruit, dried fruit, or juice concentrates when you can. You get vitamins, minerals, phytochemicals along with the sweetness, unlike empty calories from plain sugar. It does mention artificial sweeteners and advises checking with your practitioner, noting stevia wasn't FDA approved as a sweetener back in that edition. Always best to check.
Food safety is another big area with specific warnings.
Definitely. A key one is avoiding foods with nitrates and nitrites. Things like hot dogs, bacon, salami, smoked fish, cured meats.
And fish is generally good, but with caveats about mercury.
Yeah,
Right.
exactly. Fish is great lean protein, those crucial omega-3s for baby's brain. But the source clearly lists the high mercury fish to avoid. Shark, swordfish, king mackerel, tilefish, and big-eye tuna or tuna steaks. Stick to lower mercury options like salmon, sardines, trout, light canned tuna in moderation.
And the source also warns about listeriosis.
Yes, this is a serious one. Listeria is bacteria found in certain foods, and it's particularly dangerous during pregnancy. The source lists risky foods: unpasteurized milk, cheese or juices, raw or undercooked meat, poultry, seafood, or eggs, deli meats and hot dogs unless heated until steaming hot. Listeria can cross the placenta and harm the baby, even if the mother only feels mildly ill.
That's a critical warning. Okay, shifting from diet, exercise is generally encouraged.
Oh yes. The source repeats the usual benefits, helps with weight management, lists your mood, gives you those endorphin boosts.
It even mentions cosmetic perks.
It does. Suggests exercise might help weight gain distribute more favorably, more bump, less elsewhere for some, and yeah, feeling better definitely makes you look better. Safe exercise tips include snacking beforehand, not pushing to total exhaustion, and avoiding exercise in really hot weather, like over 80 degrees Fahrenheit.
And exercise during pregnancy helps with postpartum recovery, too.
A really strong link, yes. It helps tone those core muscles, aids healing, helps joints tighten up, improves circulation, reduces issues like incontinence later, plus it keeps boosting your mood and helping you cope with the stress of a newborn.
Many people are working during pregnancy. How does the source address that juggle?
It acknowledges it's tough. It talks about risks with physically demanding jobs, heavy lifting, long hours, standing all day, suggesting maybe asking for lighter duties around 20 to 28 weeks.
What about emotionally draining jobs?
The source notes that high-stress jobs can also take a real toll. The advice is basically to try and reduce stress however you can, maybe even considering changing roles or taking leave earlier if that's an option.
The source also covers getting sick and taking meds. What about something common like stomach flu?
Generally, the bug itself isn't harmful to the baby. The main focus, according to the source, should be on rest and getting plenty of fluids to avoid dehydration. Usually clears up in a day or two.
We touched on listeriosis with food safety, but it's worth reinforcing the danger.
Yes, the source stresses that the bacteria can get into your bloodstream and cross the placenta, which is why it's so risky during pregnancy, even if mom's symptoms are mild.
What about measles? Less common now, maybe, but covered.
It is. Vaccination isn't recommended during pregnancy due to a theoretical risk, though no actual problems have been reported if someone got it accidentally. Most people have immunity from childhood or prior vaccination anyway. Testing for immunity is an option. The risk in places like the U.S. is very low.
And for medications in general, the source seems to have one absolute rule.
A very clear one. Never take any drug prescription, over-the-counter, herbal supplement, anything without checking with your doctor or midwife first, period.
Crystal clear. It mentions the FDA categories for drugs, but says the system isn't perfect.
Right. The categories exist, but they have limitations, partly because drug companies aren't typically required to do extensive studies specifically on pregnant women. Also, pregnancy itself changes how your body processes drugs, so doses for chronic conditions might need adjusting.
Does it give examples of common meds and their safety?
It gives a few, always with caveats. Sleep aids like Unisom are generally seen as okay for occasional use, but check dosage. Sudafed is often considered one of the safer oral decongestants, but again, limited amounts, check with your doctor. Most antidiarrheals aren't recommended, especially avoiding things with salicylates, like Pepto-Bismol or kaopectate. Ask for safe options and focus on hydration.
For people managing chronic conditions already, how does the source frame pregnancy?
Generally, it says these conditions are manageable with good teamwork between the patient and doctor, though pregnancy can add challenges. It gives specific examples. Yeah, for asthma, the key is treating attacks quickly with medication so the baby always gets enough oxygen. If meds aren't working, head to the ER. Asthma attacks can sometimes trigger contractions, but they usually stop once the breathing is controlled. That normal late pregnancy breathlessness can sometimes feel confusing for someone with asthma, so quick treatment of any flare-up is important.
What about fibromyalgia?
The source reassures that the baby isn't affected. Mom might feel more tired or achy, though some actually feel better. Management involves stress reduction, diet, gentle exercise like stretching or water aerobics. Weight gain can sometimes be excessive. Medication management needs careful coordination with the doctor for safety.
And irritable bowel syndrome, IBS.
Pregnancy hormones often mess with bowels anyway. Constipation, loose stools, gas, so it can worsen or confuse IBS symptoms. But the source is reassuring. Pregnancy isn't inherently harder on the baby because mom has IBS, and there's no increased risk of fetal problems.
Spinal cord injury is also mentioned.
For women with SCI, there's a higher risk of things like kidney infections, palpitations, sweating, anemia, muscle spasms. Vaginal birth is often possible, but a unique challenge is that labor contractions might be painless. So the care team needs to watch closely for other signs of labor, like the bloody show or the water breaking, or by feeling the uterus contract.
That covers a really wide range of health stuff during pregnancy. Now, what about when things don't go as planned? The source includes a section on potential complications.
Yes, and it's really important to preface this, as the source does, by saying these are generally less common. This part is for awareness, not to cause alarm. Specific advice always has to come from your healthcare provider.
It starts with miscarriage, acknowledging how sadly common it is.
Yeah, the source estimates over 40% of conceptions end in miscarriage, and over half of those happen so early the person might not even know they're pregnant, maybe just think it's a late or heavy period. That's a very real loss for many.
And the source really validates the emotional pain even with early loss.
It does.
Yeah.
It emphasizes the grief is real, no matter how early. You formed a bond, you've started dreaming, and those dreams are lost. It talks about common feelings, sadness, anger, withdrawing, trouble sleeping or eating, difficulty accepting it. It also mentions the grief associated with pregnancy reduction, if that occurs.
It also tackles that feeling of guilt some people have.
Yes, and this is so important. The source directly addresses the unwarranted guilt many feel, wondering if mixed feelings about the pregnancy or negative thoughts somehow caused it. It states very clearly, nothing you did, thought, or wished for caused the miscarriage. It was not your fault.
That must be incredibly powerful reassurance. The source then details specific complications. Ectopic pregnancy.
Right, where the egg implants outside the uterus, usually in a fallopian tube. A key symptom is sharp, crampy pain, often worsening when you strain or move. But, reassuringly, the source notes over half of women who experience one go on to conceive normally later.
Gestational diabetes, GD, is also covered as fairly common.
Affects maybe 4 to 7% of pregnancies, but it's usually managed well with diet, exercise, sometimes medication like insulin or glybride. With good control, outcomes are typically excellent. Diagnosed with screening around 28 weeks. Symptoms can include unusual thirst, frequent urination, fatigue, sugar in the urine. More common if you're carrying multiples.
Preeclampsia is another condition discussed.
Affects about 8% of pregnant women. Risk factors include multiples, being over 40, history of high blood pressure or diabetes. It can lead to serious issues like seizures, eclampsia if untreated, and can cause preterm birth or growth problems for the baby. There's about a 1 in 3 chance of it recurring in future pregnancies. It's usually caught early with blood pressure and urine checks.
Placenta previa, where the placenta covers the cervix.
Yes, the most common cause of bleeding later in pregnancy. Usually managed well, but often requires a C-section before labor starts, maybe in about 75% of cases, because vaginal delivery isn't safe if the exit is blocked.
Placental abruption sounds more sudden.
It is. The placenta separates from the uterine wall too early. Symptoms can include vaginal bleeding, though not always visible, sudden severe belly pain, a hard or tender uterus, rapid contractions, fetal distress. A small abruption might allow vaginal birth, but a severe one needs an emergency C-section. It's risky for maternal hemorrhage. Risk factors include smoking, high blood pressure, cocaine use, trauma, previous abruption.
Preterm premature rupture of membranes PP-from, when the water breaks too soon.
Exactly. Before 37 weeks and before labor starts. Happens in less than 3% of pregnancies. Risks include smoking, STDs, bleeding, prior PP-from, infections like BV carrying multiples. Main symptom is leaking fluid. The source mentions a sniff test. Amniotic fluid might smell sweetish, unlike urine, but urges calling your provider immediately if you have any suspicion.
And preterm labor itself. Contractions before 37 weeks.
The goal is always to delay delivery, if possible, to give the baby's lungs more time. Interestingly, the source points out that common recommendations like bed rest or hydration don't actually seem effective at stopping preterm labor, even though they're sometimes still prescribed.
Really? So what might work?
Things like progesterone for certain high-risk cases, antibiotics if there's a GBS infection, or using tocolytic drugs. Tocolytics aren't usually a long-term fix. They're often used just to buy maybe 48 hours enough time to give the mother steroid shots to help mature the baby's lungs quickly before birth. Delivery is considered if the risks of staying pregnant outweigh the risks of prematurity.
Uterine rupture is mentioned as rare, but serious.
Very rare. A tear in the uterine wall, usually along a previous C-section scar. It's the most serious risk of VBAC, vaginal birth after cesarean, especially if labor is induced. Requires immediate C-section and repair. Prevention for high-risk women might involve careful monitoring or avoiding VBAC induction.
Even rarer is uterine inversion.
Extremely rare. The uterus turns inside out after delivery, often linked to issues with placenta removal. Can cause major hemorrhage if not treated quickly, but again, very unlikely.
Finally, postpartum hemorrhage, PPH, excessive bleeding after birth.
Occurs in about 2–4% of deliveries. Causes include the uterus not contracting down properly, maybe after a long labor or if it was overstretched, placenta issues, fibroids, retained placental fragments, which can cause late PPH, or infection. Key symptom: soaking more than one pad an hour for several hours. The advice: call your provider or 911 immediately, lie down, put an ice pack on your lower abdomen.
That section gives important context on potential issues, while stressing they aren't the norm. It brings us right up to the big event, labor and delivery.
Yes, and the source spends a lot of time here preparing for and understanding it. It totally validates the fear of labor pain, says it's common, normal, and highlights childbirth education as key for learning coping tools.
Practical prep is covered too.
Definitely. What to pack for the hospital. And a great tip: stock up at home beforehand. Pantry, freezer, paper goods. Much easier to do that at 9 months pregnant than with a tiny newborn.
The birth plan, lots of people focus on that. How does the source frame it?
As a plan or a wish list, not a contract carved in stone. Its main value is starting conversations with your provider and the hospital, figuring out what's realistic, what policies are, and acknowledging that labor is unpredictable. Having one helps manage expectations, reduces disappointment if things change, and encourages flexibility.
It also gives a feel for the hospital environment.
Describes modern birthing rooms trying to feel more home-like, hiding the medical gear. Adjustable beds, maybe tubs or showers. On arrival, registration, pre-register, LDR rooms, sometimes triage. Notes your partner might wait briefly, so speak up if you want them with you always.
Knowing when to go is key. Recognizing real labor versus false labor.
The main difference is the pattern. Real labor contractions get stronger, longer, and closer together over time. Maybe not perfectly regular, but the trend is progressive intensity. False labor, Braxton Hicks, doesn't usually follow that pattern.
Other signs labor might be starting.
The bloody show, losing the mucus plug, often means labor within hours to days. Intensified Braxton Hicks, maybe even diarrhea for some people.
And when should you actually call the doctor or midwife?
When contractions are getting regular, like maybe 5 to 7 minutes apart consistently, don't wait for textbook perfection if they're clearly progressing. Call even if unsure, they might tell from your voice. And call immediately for heavy bleeding, pain with spotting, or if you think your water broke, use that sniff test maybe. But call regardless of doubt. The labor process itself is broken into stages. Stage 1 is labor. Early, active, transitional phases.
Transition is supposed to be the toughest part.
Often the most intense, yeah. The source gives tips for the coach. Quiet support, simple instructions, encouragement, breathing with the birthing person, helping them rest between contractions.
Stage 2 is pushing and delivery. How long does that usually last?
Guidelines suggest around 2 hours for first-timers without an epidural, maybe up to 3 hours with one. Emptying your bladder and bowels beforehand helps. Using gravity sitting, squatting, walking earlier, and putting positions like semi-sitting or squatting can help baby come down.
Baby's position matters a lot too, right?
Crucial. Ideal is head down, facing mom's back, occiput anterior. Facing mom's tummy, sunny side up, can make labor longer. Breech, bottom first, often means C-section, though sometimes a trial of labor is possible. Flexibility is key.
What if labor stalls? Interventions might be needed.
Yes, if dilation stops or baby isn't descending, options include pitocin, oxytocin to boost contractions, prostaglandins to ripen the cervix, or breaking the water, amniotomy. Nipple stimulation is even mentioned as a possible natural booster.
Pain management, obviously a huge topic. Discussing options beforehand seems critical.
Absolutely. Talk with your provider way before labor. Keep an open mind about both medication and non-drug techniques. CM.
For epidurals, what does the source describe?
Often getting IV fluids first to prevent blood pressure drops. Catheter use varies. Main downside is limited movement during labor.
Any SAM techniques mentioned?
Reflexology, massaging foot points is mentioned, potentially relaxing the uterus, reducing pain, shortening labor. Caution against uterine points before labor. Physical therapy, things like massage, HEDIS packs, counterpressure are also listed.
Monitoring the baby during labor is standard practice.
Yep. External uses belts, tracks contractions and heart rate, allows some movement. Internal uses a tiny electrode on baby's scalp and a catheter in the uterus for more accuracy, often if there are concerns. Slightly higher infection risk limits movement more.
Sometimes delivery needs a little help, like forceps or vacuum.
Used in a small percentage of births. Reasons include mom being exhausted, a health issue, fetal distress near the end, or needing to rotate baby slightly. Safer with an experienced practitioner.
Cesarean delivery, C-section, is more common now. Why is that?
Several reasons. More repeat C-sections, fewer forceps vacuum deliveries now. C-section might be chosen instead, sometimes maternal request. Source presents it as safe, avoids labor pain, keeps perineum intact. Unplanned C-sections happen if labor stalls, uterus isn't contracting well, or pushing isn't progressing. Recovery involves managing surgical pain.
The source even covers the very rare event of an unexpected home birth.
Briefly, yes. Basic instructions: lie down, unlock door, ease baby out, counter pressure, check cord. Preparedness for the unlikely.
After the baby arrives, those first moments, what happens?
Suctioning baby's nose-mouth, delivering shoulders body, clamping and cutting the cord partner can often do the cutting.
And skin-to-skin contact is really encouraged.
Highly recommended. Calms the baby, helps him sleep. Source also touches on baby's initial appearance. Temporary skin color changes, rashes, dryness, lanugo hair are all normal. Cord blood banking is mentioned as an option too.
That gets us through the birth itself, but the journey definitely continues into the postpartum period.
Absolutely. And the source normalizes not feeling 100% physically or emotionally right away. Calls it par for postpartum. Common symptoms are expected. Serious problems are rare.
Physical recovery takes time.
It does. Managing C-section incision pain. Postpartum backache is common, ligaments still loose, abs weak, plus carrying the baby.
Urinary or fecal incontinence are also discussed.
Acknowledged as common. Kegels are strongly recommended, crucial for healing, tone, preventing future issues. They work even if things feel numb at first. Kegels also help perineal healing by boosting circulation.
Postpartum hemorrhage risk is mentioned again here.
Yes, reiterating the sign, soaking more than 1 pad per hour for hours. And the action: call provider, lie down, ice pack, immediate action needed.
Emotional well-being is a massive part of postpartum, distinguishing baby blues from postpartum depression.
Very important distinction. Baby blues: common, mild sadness, crying, irritability, usually gone within 2 weeks. PPD: more severe, persistent sadness, hopelessness, trouble caring for self or baby, withdrawal, anxiety, aversion to baby, memory issues. Thyroid problems can mimic PPD. Key message: get professional help if you suspect PPD. It's treatable.
Adjusting to being a mother takes time too, right?
Totally. The source says feeling like a mother isn't instant. Parenting skills are learned by doing. Advice: lower expectations for yourself and baby. No perfect parent or baby. And crucially, don't try to do it all alone. Ask for help: partner, family, friends, even paid help like a cleaner or doula.
Taking care of yourself isn't selfish, it's necessary.
Essential: eating well, especially if breastfeeding. Grazing on protein complex carbs for energy, avoiding sugar caffeine crashes, staying super hydrated for recovery and milk supply.
And rest, the holy grail for new parents.
Yes, so hard but so important. Using baby's naps for mom to rest is the classic advice for a reason.
Postpartum exercise is also pushed.
Vital, according to the source. Cones, abspirinium, aids healing, tightens joints, boosts circulation, reduces incontinence. Plus, mood boost. Rules for first 6 weeks: short sessions, slow moves, no bouncing, avoid full sit-ups initially.
What about losing the baby weight?
Depends on gain during pregnancy, diet, exercise, genetics. Exercise beyond just daily baby care is key for weight loss and overall fitness.
Breastfeeding gets significant attention.
Presented as nature's design, perfect food, perfect delivery system.
And the benefits are huge.
Overwhelmingly positive, per the source, for baby. Fewer allergies, less obesity, less illness, better brain development. For mom. Faster recovery, reduced cancer risks later. Prep during pregnancy is minimal. Maybe avoid soap on nipples late term.
Getting the latch right sounds critical.
Absolutely essential. Baby needs a wide mouth. Bring baby to the breast, don't lean over, let baby lead. Needs to latch onto nipple and areola to get milk effectively and avoid pain cracking. Reassurance. It gets easier with practice. Other options like bottle feeding exist too.
Resuming sex postpartum is another common question.
Source acknowledges a huge range of normals, for desire returning anywhere from weeks after getting the okay to 6 months or more. Libido might return after weaning for some. Key point. Closeness and intimacy matter even if sex drive is low.
Long-term recovery is touched on too.
Yeah, C-section recovery takes longer than 6 weeks. Thinking about future pregnancies is mentioned too.
Now, we focus heavily on the birthing parent, but the source has a whole section for the expectant partner, the dad usually.
It does, and it's great that it frames fathers or partners as vital team members, nurturers, sharing the excitement, responsibility, and worry. Validates their unique concerns too.
What common fears for fathers does it mention?
A big one. Fear of not being a good dad, especially with no newborn experience. Source calls it terrifying, but normal. Reassures that parenting is learned, not innate. Learn on the job, from mistakes, though classes books help. Trust your instincts, dads have them, and different parenting styles are okay.
Supporting your partner emotionally is key too.
Yes, understanding her mood swings are often hormonal. Asking what do you need is crucial.
Bonding with the baby is addressed specifically for dads.
It is. Starts with cuddles, deepens over time, not always instant. Every interaction builds the bond: diapers, baths, kisses, just looking at their face. Eye contact, skin to skin, holding baby on chest are highlighted for closeness and even brain development. Relationship feels one-sided at first, but your attention builds baby's security. Those first smiles are the reward.
Sex and intimacy from the dad's viewpoint.
Addresses fears about sex during pregnancy. Reassures it's usually safe, baby is protected and unaware. Mild contractions after orgasm are normal. Acknowledges feelings about wife's breasts might shift, sexual versus feeding, and feeling weird about breastfeeding is okay. Postpartum sex drive varies for dads, too.
Managing his own moods postpartum is also covered.
Yes, factors like sleep deprivation, stress, hormones. Dads have shifts, too. Loss of freedom, tips, exercise, get busy with baby care, boost spirits, limit alcohol, drugs, the depressants.
It encourages a perspective shift too.
Yeah, focus on the gain. This amazing little person, not just the loss of the old life. Life changes but becomes immeasurably better.
And fascinatingly, it even talks about expectant father dreams.
It's a really insightful touch. R-rated dreams early on, later family themes, dreaming of being a kid again, fear of responsibility, being pregnant, empathy, jealousy, or dropping the baby. Insecurity about fatherhood, very common.
Validating those subconscious worries is powerful.
It really offers a well-rounded view of the partner's experience, their vital role, and their feelings.
Wow. We have covered an incredible amount of territory in this deep dive, haven't we? Based on what to expect when you're expecting. We've gone all the way from thinking about conception, confirming it, through all those physical and emotional waves of pregnancy, tackling health stuff, potential bumps in the road, getting ready for and going through labor and delivery, and then stepping into that whole new world of postpartum recovery and adjusting to life as parents for both mom and dad.
And this whole exploration was really tailored for you listening right now.
Yeah.
Taking the source material you provided us with and trying to build a kind of roadmap from it, hoping to help you feel a bit more informed, maybe a bit more confident about whatever stage you're at.
Yeah.
Distilling these key insights. Hopefully that's been useful.
Yeah. And as we've seen all through this source, this whole journey involves just a massive amount of preparation, doesn't it? Practical stuff like choosing doctors, making birth plans, stocking the kitchen, learning totally new skills.
Loads of prep.
But it's also so clearly a path that's just full of unexpected twists and turns. You absolutely need flexibility. You need to adapt constantly.
Maybe the real plan then isn't so much about trying to control every single little detail, right? Maybe it's more about building up your resilience, getting the knowledge you need, and having that superb system in place so you can kind of roll with the punches, embrace the unexpected when it happens.
That's a great thought to end on, something to keep in mind as you navigate this amazing, wild journey. Thank you so much for joining us on this deep dive. We really hope it's given you some valuable insights and maybe spark some more curiosity as you continue on your own unique path.